Welcome to week 25 of the Mom Stay Fit week by week pregnancy update. In this video, we're going to break down what is going on with your baby during week 25 of your pregnancy, what might you be experienced during this week of pregnancy, and then also how am I doing during my week 25 of pregnancy, because I am currently pregnant with baby number 4 and I am on this journey with you. So if you are currently pregnant, be sure to comment below to let us know how you are feeling, because we would love to connect with you on this journey. Before we dive into what can you expect during week 25 of your pregnancy, I do want to share that my book Training for Two is now available for pre-order. Training for Two teaches you how to use prenatal fitness to support you throughout your pregnancy as you prepare for birth. There's tons of exercises in it with pictures and QR codes for videos. And so if you want to check it out, head to the notes below. So Roxanne, what is going on with baby during week 25 of pregnancy?
So week 25, baby is the size of either a Napa cabbage, if the vegetable resonates with you more, or a T89 calculator. If you are a kid who used a calculator in, I think, high school, like you had to buy this special calculator, T89, that's how big your baby. And it's important to note the size reference is not like the length of baby anymore. It's not from head to foot. This is from head to butt. So if that helps, because some people are like, well, why does all of a sudden my baby was a banana and then it was like a freaking, like a melon? Well, it's because baby, it was a measurement from the head to the foot. And now it's like
We've upgraded.
Butt to head, because that's how they are in the womb. They're like this. But other than that, what is happening with baby is, number one, their startle reflex is starting to develop now. So that nervous system, again, is starting to further develop every week. But now that startle reflex, which is the reflex when either a loud noise or it feels like if you like let go of their hands, it feels like they're falling and they like jut out their arms and like, what the heck? That is developing now. So this is one of the reasons that people will like swaddle a baby when they're born, that reflex, because they can like startle themselves awake sometimes with that reflex. So another thing that's happening is the capillaries are starting to develop, which are like tiny little blood vessels within our skin as well as their lungs. And so their skin was transparent. And so as they're putting on more fat onto their body, as well as these capillaries, their skin is becoming less transparent, so more opaque with like a little pink tinge. And like I said, babies are starting to like put on more weight now. So they're starting to fatten up a little bit and like get a little bit chunkier. Those cheeks are starting to grow as well, like little rolls in their arms. But fun fact, their motor system, again, develops every week. And now they can like stick out their tongue, which is really helpful for like feeding and nursing and or drinking a bottle, like being able to control their tongue. It's like the beginnings of being able to like suckle, which is really cool. So that's really it with baby. But with you, there are lots of things that could be happening during like week 25, middle of that second trimester. There's lots of symptoms that different people might experience that others might not. So just a few for 25 weeks is one, insomnia. Insomnia is very common. Gina is experiencing during her pregnancy. It could be due to just like the hormones and like how you're feeling. Maybe you didn't drink enough water during the day, like electrolytes, but it could also be due to low blood sugar in the middle of the night. And so if you haven't yet taken your gestational diabetes screening, the screening opens up to you could take it anytime between 24 and 28 weeks. And gestational diabetes is insulin resistance that could develop during pregnancy. So we do this screening so that you can test to see if maybe you have like a blood sugar insulin resistance during pregnancy. And a low blood sugar in the middle of the night could be related to gestational diabetes, and it could lead to waking up in the middle of the night. Some other things that could be happening is if you have carpal tunnel. So if all of a sudden like your fingers are really tingly, even like restless leg syndrome. So your legs feel really tingly and you feel like you need to move them. This is all due to lovely pregnancy hormones. So swelling could start to happen within our wrists. That's putting pressure on the nerves. So like there's a nerve within our hand, and that's what leads to that tingling feeling, is the pressure on those nerves. And this is due to pregnancy carpal tunnel, which is really great. So there are things that we could do to help decrease that inflammation. So you could do like massage, TENS units, or like putting your hand in like ice water to decrease that amount of inflammation that's causing those symptoms. But sometimes seeing either like an OT during pregnancy or someone during pregnancy to help treat that carpal tunnel other than a wrist brace can be beneficial. The restless leg syndrome can be due to nutrition. So maybe we might need to incorporate more magnesium because we're having that tingling in the legs where we feel like we need to move them. And then this could lead to insomnia as well. So it's like all of the things just like compound onto one another, because the carpal tunnel could also cause you to wake up in the middle of the night because it's really not comfortable. So insomnia just caused by many, many things. One of the positives that you might notice, though, during week 25, because there's all these like negative symptoms, but one of the positives during pregnancy is that pregnancy hormones stop your hair from shedding as much. So you hold on to your hair longer because of the pregnancy hormones, which is a great thing because then you have like luscious locks during pregnancy. But then postpartum, that all falls out. But positive symptom during pregnancy is you have luscious, voluminous hair because it doesn't fall out as much. So, fun side of being pregnant, because I feel like there's a lot of negative side effects of you can have heartburn, which like heartburn and like burping more during pregnancy as well is another fun common symptom that you could be experiencing right now. But like, oh, like you can have carpal tunnel, restless leg syndrome, insomnia, burping more, heartburn, not great. But your hair, great. Looks great. But that's it. How are you feeling, Gina?
So this week I have broken out the pregnancy pillow. Like it was kind of out for a little bit at one point and then it went away, but now it's definitely out because if I don't sleep with it, I have pelvic pain when I wake up. I have like hip pain when I wake up. And one of the reasons that you may have more like hip pain during pregnancy after sleeping, which then can also contribute towards that insomnia, is the position of your hips and like your pelvis while you're sleeping. And so usually the legs just kind of like lay together if you're in a side lying position. But as like we get more pregnant, there's just more movement that's happening within our joints. And so like the legs being together can cause some discomfort. And so you might have one leg that's in like more external rotation or more internal rotation, just kind of like torquing at the hip. And so you can take a pillow and place it between both your knees and your ankle. So it's not just knee, because that would just bring both hips into external rotation. We want to support both the knee and the ankle. And that could help bring the hip just into a little bit of more of a neutral position to make it more comfortable for you. And there's so many different types of pregnancy pillows out there. Right now I'm using this like C-shaped one because it kind of makes like a little nest for me because like my kids sleep with me in bed. And so they like to cocoon up in there with me as well. But that allows me to put the pillow between my legs. I do have one that's just like a straight pillow that I put like for my lower leg, which makes it really easy for me to kind of flip sides. I find with like the C-shaped pillows, I have to like kind of take the whole pillow with me to rotate, which makes it a little bit harder to like change positions. And so I find just like the straight pillow is like really easy to kind of flip flop back and forth. So there's so many different pregnancy sleep options. We have like a whole video that we break down like sleeping positions as well for pregnancy, and then also how to move around during when you're in bed as well. Because if you are having any sort of pelvic pain, moving in bed can be like really painful as well. And so because I was having a little bit of pelvic pain because of my sleeping position, one, broke out the pregnancy pillow, and that has definitely really helped a lot. But then I was doing a bunch of exercises to kind of help relieve the discomfort that I was having. And it pretty much resolved like almost immediately, which was amazing. And I was very happy for that. The exercises that I was doing to help resolve the pelvic pain that I was having, so I was having more like left SI joint pain, is a lot of hip shifted exercises. So I was essentially shifting my weight to my left leg and bringing that hip crease back, which was stretching more of that back half of the pelvic floor on the left side, bringing that pelvis into more internal rotation. And so that was kind of like countering the common position of our pelvis. I did like a few different hip shifted exercises, and that really helped to like relieve the pain. And then I did some myofascial release with like a tune-up fitness ball. They're a little bit softer than like a lacrosse ball, and they have like different sizes. And I would just put it like right in that like gap between like my tailbone and like my sits bone, and just kind of like massage that like glute booty area. And that also like really helped a lot. And so combination of hip shifted exercise, some myofascial release, and then sleeping with a pregnancy pillow, pelvic pain has now been resolved, which was really nice. And then also wearing the belly band for like some additional support for my belly, especially when I was like more on my feet during this week, has been like really helpful. So focusing a lot on my comfort and keeping that comfort as I rapidly near my third trimester. I feel like it's
15
getting
weeks
here
left.
super fast. My app was like 14 weeks to go, and I was like, wait, what? Like, what do you mean? Like, no, surely not. So I've definitely been incorporating a lot of comfort strategies, doing a lot more of the Mama Stay Fit birth prep circuit as well to help support baby's position, especially now that her vestibular system is starting to develop, like really trying to encourage her to get into that head down position with inversions. And then also helping to support my own comfort during my pregnancy with helping me to change positions and to incorporating those hip shifts with the birth prep circuit. If you want to check out the Mama Stay Fit birth prep circuit, it's a free circuit that's available for you. We'll link it down in the notes below. It's a PDF that has pictures and then also QR codes to breakdown videos where you can learn all the exercises that I'm incorporating into my prenatal routine to help me prepare for birth. It helps to support baby's position and then also to release common areas of tension throughout pregnancy. Other than the little flare-up of SI joint pain from sleeping kind of funky, I've been feeling pretty good. Workouts have still been really consistent, which I've been really pleased with. And yeah, just kind of moving along to the third trimester. No other big complaints, really. And yeah, feeling good. Thanks so much for watching the week 25 update on what to expect during your pregnancy. Hopefully you are not experiencing quite as many of those symptoms that we talked about that you might be experiencing, but do know that pain is not a requirement of pregnancy and there is a lot of options for relief. And so if you are having more of that carpal tunnel, working with an occupational therapist or OT can be really beneficial. If you're having that pelvic pain, working with like a physical therapist, even during pregnancy can be super beneficial. And if you're having insomnia, like working with your provider to figure out if there's like a strategy to help you get more sleep, which could include like doing some meditations, drinking some terry tart juice, maybe incorporating some medication. We can definitely find sleep during pregnancy. It may be a little bit harder to achieve, but there is relief with all of these symptoms during pregnancy. And hopefully we have the luscious locks and then just leave that one alone. Just let that one happen. So thanks so much for watching. If you want more from us, check out our prenatal fitness programs. Our prenatal fitness programs are designed to keep you strong and comfortable throughout your pregnancy because, again, pain is not a requirement, while also helping you to prepare for birth. So I'm currently doing our prenatal strength program, which is our Team Builder app-based program. It's a list of exercises with short demo videos. If you prefer to work out in a gym or with a barbell and at your own pace, that workout is a great option for you. I'm also refilming our prenatal on-demand program, which is a full-length workout video that you can follow with and work out with at the same time. So if you prefer to see a video and just kind of copy what I'm doing, that's a great option available for you. We have it both with strength training and prenatal yoga as well.
And if you're looking for a childbirth education course to help prepare you for birth, check out our online childbirth education course where we discuss the science of labor and birth to help take some of that mystery away to make it less scary. We also incorporate how your birth partner can support you, what labor positions you can utilize, labor comfort measures, and birth options so that you know your options for birth. And you can check out our prenatal fitness and our childbirth education on our website at momstayfit.com and use code YouTube10 to get 10% off any of our offerings. You can also bundle those two together to get an additional 15% off, which then makes it 25% off. So it's like basically free at that point.
So thanks so much for watching. If you are pregnant, be sure to comment below to let us know how you are feeling during your 25th week of pregnancy because we would love to connect with you on your journey.